Hi everyone, welcome to RMU Psychology Presents Let's Talk, a day in the life of a drug and alcohol counselor. Before we begin, just a reminder for virtual webinars that we will be recording this session and that please mute your microphones until the end, and then if you have any questions, please leave them in the chat until the end, and then we will answer any questions that you have. All right, so my name is Briana Bunner. I am a second-year Master's in Counseling Psychology student and a graduate assistant for the Psychology Department. A little overview for today. So we're going to introduce drug and alcohol counselors, kind of talk about a need for drug and alcohol counselors, talk about their day in the life, whether in individual and group therapy, trauma and addiction, and how that can relate to trauma-informed care, and then a day in the life documentation, counselor self-care, and then there'll be a video that is watched where we see their role in a recovery video, and then any questions at the end. All right, so introduction to drug and alcohol counselors. So a drug and alcohol counselor, also known as a substance abuse or addiction counselor, is a support for people with drug and alcohol problems and other behavioral issues. So they teach individuals how to modify their behavior with the intention of full recovery. So many substance abuse counselors with clients or work with clients on an ongoing basis due to a client's susceptibility to relapse. The goal is for them to go through the treatment just in one time, but more often than not, people do tend to relapse or need a longer term counseling. Other duties include meeting with clients to evaluate the health and substance problem, identifying issues and creating goals and treatment plans for the client, teaching clients coping skills. So when they're struggling with various skills, they learn healthy habits to kind of counterbalance the negative habits that they have. Helping clients find jobs or reestablish their career, leading group therapy sessions, providing updates and progress reports to court if they are mandated to be there, referring clients to support groups, setting up aftercare plans, and then meeting with family members and providing guidance and support. So a need for drug and alcohol counselors. Substance use disorders represent clinically significant impairment caused by recurrent use or alcohol or illicit drugs, or both, including those impairments can include health problems, disability, failure to meet major responsibilities at work, school, or home. So the consequences of substance use disorders can be costly to people and the nation as a whole because they are often associated with negative outcomes, such as involvement with the justice system, occurrence of chronic health conditions, and poor health outcomes. So a 2015 national survey on drug use and health data indicated that 8.1% or 21.7 million people aged 12 or older needed substance use treatment in the past year, so in 2015. In 2015, an estimated 2.3 million people aged 12 or older who needed substance use treatment received treatment at a specialty facility in the past year. So this number represents 10.8% of 21.7 million people who needed substance use treatment in the past year. So among the estimated 19.3 million people aged 12 or older who are classified as needing treatment but not receiving substance use treatment at a specialty facility, about 18.4 million or 95.4% did not think that they needed treatment in the past year for their substance use problems. So what that tells us is that there is a need for drug and alcohol counselors due to the increase in substance use, illicit drugs, impairment in social and other areas of functioning. So there's a need for it, and we'll kind of dive more into the daily life of a drug and alcohol counselor. So here is a video. There we go. Okay.
Addicts need professional help during the recovery process. Addiction counselors aid an addict in various areas of recovery, understanding their addiction, and assuring them of their decision to recover. Are you thinking of becoming an addiction counselor? In this video, we go over what you need to know about what they do. Communication. Addicts are enduring a lot during rehab. They have many questions and uncertainties with sobriety. They're also coming to terms with their addiction and even a mental disorder or a past event. As a counselor, you'll communicate all of this information with them. You'll use a combination of endearment and understanding, but will also use your knowledge of addiction to give them a rational explanation of what they're going through. Listening. While it's easy to want to give advice and educate an addict, it's equally important to listen. An addiction counselor needs to be a great listener. Addicts have many emotions when they go through treatment. Oftentimes, all they need is to just express their feelings. Listening is also integral because it will help you understand your patient better. Encouraging recovery. Addicts are dealing with withdrawal symptoms, they're fighting cravings, and are struggling to find a purpose in life. This is where an addiction counselor comes in. They encourage their patients to stick with rehab and treatment. They let them know how wonderful they're doing and the benefits a sober lifestyle will bring. Allying with patients. Addiction counselors are unlike traditional counselors. Addiction counselors create a true bond and connection with their patients. An addict needs a backbone during recovery. The counselor will create a bond with patients so they know they always have a support system. Unique experiences. No two recovering addicts are the same. Every addict endures different emotions, symptoms, and thoughts when going through recovery. An important part of an addiction counselor's job is to not treat every addict the same. You have to assist your patient through their unique recovery journey. It's easy to take every patient like a textbook study. You'll likely meet with several patients every day. As you gain experience as an addiction counselor, you'll learn ways to communicate with each patient to ensure you're giving them personalized service. Building trust. An addict is going through a lot when they're recovering. They're enduring one of the most difficult times of their lives. It's easy for an addict to feel rebellious, to have emotional outbursts, and not want to comply with their treatment. One of the reasons they behave this way is they're lacking trust. The substances were their only trusted companion for years. They feel like they have nothing and don't know what life is without their substance. Part of your job as a counselor is to help an addict build trust again. Without trust, your patient won't receive the help they need. This is a skill you'll learn from experience in the profession. Support group referrals. Counseling isn't a former addict's only option for help. Connecting with like-minded peers helps an addict understand their addiction and reinforces that they're not alone during the recovery process. But how does one go about finding support groups? The addiction counselor will start recommending support groups during their first sessions. As an addiction counselor, you will build up a list of support groups for different substances. There are even support groups that help former addicts engage in other hobbies, such as yoga or art. With so many people suffering from substance abuse, the demand is growing for addiction counselors who are willing to help. If you want a fulfilling career where you give back, consider helping substance abuse addicts by being an addiction counselor. If you want to become a counselor, you need proper schooling. Visit our site for more info.
All right. So to recap the video, it just kind of outlines a lot of different tools that counselors need in order to work with clients. So another kind of day in the life of a drug and alcohol counselor is individual and or group therapy. So on the surface, a typical day for a counselor will include individual and or group therapy. So individual therapy is a one-on-one discussion. This can be like talk therapy or cognitive behavioral therapy, trauma-informed therapy that is directly done with the client from the counselor's perspective. And then it's critically important to build rapport between the counselor and the client because that will define the course of treatment. Excellent counselors are able to use empathy, active listening, and concise communication to allow their clients to open up and discuss their very deepest thoughts, feelings, and concerns, specifically related to drug and alcohol or any trauma that they had that relates to drug and alcohol. The number of clients each counselor will see will largely depend on the facility and their policies. So moving on to group therapy. Group therapy is approximately 1 hour long session with multiple clients who discuss their lives, prior drug use, goals, and are more in a support style setting. So it's a bunch of individuals sitting around in a group, more often than not in a circle, so that they can see one another and they kind of do like a check-in and talk about the progress and talk about where they're at and allow the group, in addition to the counselor, to provide support for them. So counselors will excel by promoting open and honest discussions between clients, allowing them to learn from each other and limiting their own role to that of a moderator rather than a dictator. So the ultimate goal for a counselor in a group therapy setting is that the group will practically run itself, where other people are sharing their knowledge, information, their education that they've learned, and the therapist or counselor is just there to kind of encourage that relationship, encourage some like independence as well. So next, a day in the life, trauma and addiction. So trauma is the leading cause of substance abuse and mental illness. Trauma is an event or series of events that make a significant psychological impact or impression on a person that may not change their behavior, but can often lead to serious consequences. So trauma and addiction are linked in trying to understand the disease of addiction and the many layers that it has as it takes over a person. Some believe that trauma and addiction are the same thing and that addiction can be another name for trauma. Many times it is a type of trauma that occurs in a person's life that makes them reach out to something to fill the void that was emptied or destroyed, as well as to deal with the pain and suffering. So common types of traumas include childhood abuse, sexual abuse, rape, and PTSD. So when trauma like that occurs in a person, they often go to something to fill that void or to kind of numb that pain. So they're often numbing their feelings through drugs, alcohol, and other mind or mood altering substances. So with trauma cases, it is unfortunately becoming a part of their lifestyle, personality, and belief systems. So trauma at a young age can be damaging and can carry into their adulthood if not handled properly. Moving on to trauma and addiction, trauma-informed care. So trauma-informed care is a critical part of substance abuse and mental health treatment. A counselor's job as part of the larger trauma-informed care program is several-fold. So first, counselors must create a supportive and safe environment that allows the client to explore their trauma, its effects, and how they intend to overcome it. Treating substance abuse or mental health issues without addressing the underlying trauma issues is a recipe for ineffective treatment and reduces the likelihood of long-term positive results. Second, once the trauma has been identified, counselors have the responsibility to address it in a compassionate and empathetic way. There is an instance where trauma is minimalized or dismissed by the counselor that can actually worsen the traumatic event and allows the client to relive it, thus re-traumatizing the client. Finally, counselors will work with their clients to implement long-term strategies to address trauma, identifying risk factors, and assisting clients to avoid traumatic events in the future. So trauma-informed care is a process that requires buy-in from the counselor, the client, and the facility as a whole. Combined with effective substance abuse and mental health program, trauma-informed care can improve long-term results. All right, continuing on to a day in the life, documentation. So less visible but equally important is the counselor's responsibility to document a client's progress, clinical notes, and thoughts. So documenting how a client progresses is important considering that mental health and addiction issues are chronic, meaning they stay with a client for their entire life and potentially reoccurrent. Clients may relapse, requiring additional treatment. During a client's initial recovery, the counselor may have to refer a client to a medical specialist or to another specialized facility, thus requiring strong documentation to ensure the continuation of care and understanding the client's needs in course of treatment. So two purposes of documentation. First, the treatment plan is fluid as it can and will change over the course of a client's treatment. To objectively and appropriately modify the treatment plan, the documentation from every clinician must be collected and analyzed. Second, insurance companies require appropriate documentation of progress in treatment in order to approve further care. With appropriate documentation of clients' progress through treatment, the goals for the insurance company to approve necessary care, ultimately benefiting the client. Documentation is also important for a counselor in the sense that it is a safety net in a way that if anything were to ever happen with a client, there is documentation to prove what was said in session, what wasn't said in session, what happened, the steps that were taken, and the responsibility of the clinician and the facility as a whole. Continuing on, so a day in the life, counselor self-care. The risk of burnout and emotional stress that counselors will experience every single day at work are reasons why counselors' self-care is of greatest importance, especially for those new in the field. So stress management and self-care examples: journaling, reading, meditating, and practicing gratitude, movement such as running, biking, lifting, hiking, therapy, having a strong support system, unplugging from social media and technology, time with animals, mindfulness, balance in all areas of life, so nutrition, sleep, social, spiritual, emotional, and mental, and then taking breaks. All right, continuing on, most counselors benefit from regular counseling sessions of their own. So there can be discussing and exploring their emotional well-being and the effects that counseling has on them, reflecting on their own struggles and challenges to ensure that their stuff does not get taken into the counseling sessions with their clients. And this is referred to as countertransference. Reflecting on their role as a counselor. So for instance, if a client is not ready to recover and the course of recovery fails, a client may end up relapsing. So there's potential that a counselor may take it as a personal failure. So understanding what the counselor's role is in the client's treatment plan. So are they there to support them? They're not there to, do most of the work for them. If the client's not ready, then there really is no point, and honestly, it won't even benefit the client because they're not ready to change their behaviors or their mindset. Reflecting on the meaning of their clients. For instance, if a client passes away, there is potential for certain feelings to arise. It can be absolutely devastating for the consequences of drugs and alcohol and mental illness, and that it could potentially end in a client passing away. And kind of reflecting on those clients, reflecting on those feelings to make sure that you aren't as affected or that you can kind of work through those emotions. Also, having a support system allows counselors to cope with struggles that arise as a drug and alcohol counselor. So in a professional world, you have colleagues, individual supervision, group supervision, and consultation. In a personal setting, there is family, friends, animal spiritual guidance, and therapists that can help. And those are just some examples. All right, so how to find balance, professional versus personal. So in order to kind of help with that self-care, help with avoiding burnout, it is essential that you set and maintain boundaries. And that can be in a professional setting, in the workplace, or just with a client or colleagues. So that can look like, only having an hour session if you are kind of strict with, all right, like I'm not going to go over unless it's an absolute emergency. If there's a client that tends to like to talk and want to sit and stay in that space, you say like, okay, like as noted before, these sessions are normally an hour long. How can we kind of shorten that, and how can I make sure that you get the best care possible within the time frame that we have set aside? Taking off the therapist hat, so kind of making sure that you're leaving work at work and you're not bringing it home with you. The burnout can become more intense if you're bringing the work home with you and vice versa. So like if you are taking your personal stuff into the counseling sessions, it can be really challenging, also affecting the client and the relationship with the client, but also causing you extra stress. Strong time management for boundary setting. So time management can look like prioritizing, various self-care methods that we mentioned to make sure that you are staying on top of like your own mental health as well as being capable of working with clients. So strong time management can look like making sure that you only work from 9 to 5, and that once you leave at 5, you're not taking anything home with you, and then you're kind of working on yourself, working on your relationships with your family, having time for you after work. Taking time off every 6 months minimum, so that can allow you to recover from all of the stress, the burnout, the emotion that you're taking on, or the emotion that is related to your clients. And then supervision and consultation. This can help with your professional versus personal life if there is some things that you're questioning, kind of seeking some supervision, seeking relation or conversations with colleagues to ensure that everything is working out the way it needs to work out. So this picture is just finding balance. So with friends, chores, exercise, eating, sleep, work, and family, making sure that the priorities that you have in your life, kind of maintain balance. So you don't have to necessarily have all of those, but if you have some that are really important to you, making sure that you're splitting up that time and that maybe one category isn't kind of taking up most of your time. All right, so here are the references, and if you have any questions. So thank you for attending this presentation today. And as a reminder, we will continue to do these for the fall, so look out for the webinar series links, look out for the emails. There will also be tip sheets and discussions that will be sent out. But yeah, just keep an eye out for that. So thank you.